So what is labiaplasty? It is a plastic surgery done to alter the size or the shape of labia minora, that is the inner lips which cover the introitus or the opening of the vagina. Who is a good candidate for labiaplasty? So labiaplasty can be done for functional reasons, like many females, they feel uncomfortable wearing tight clothes, or there may be some chafing. And the second reason is aesthetic. Patients or females, they lose their confidence, they feel that the lower part, that's not very aesthetic. So in order to make it aesthetically beautiful or good looking, many clients, they get it done. Or some females, they may have asymmetry. One labia may be small and the other may be larger. To correct that asymmetry, labiaplasty is done. Next question is whether it is done under local anesthesia or general anesthesia. See, labiaplasty can be done under local anesthesia. There is no pain, we anesthetize. But I think if we give some IV sedation, that's the client is more comfortable. Increase in size of labia minora can be genetic. Naturally, the labia are large in some females, or it may be because of some hormonal imbalance or hormonal changes, for example, during puberty or during pregnancy or during menopause. These can cause variation in the size in the labia minora. Next very common cause is childbirth. When there is vaginal delivery, the labia minora may get enlarged in size or they may become asymmetrical. Then there are some other causes like aging. The aging may cause saggy skin. The elasticity of the skin is reduced, as a result of which the skin sags and the labia become enlarged. Another cause is chronic irritation or chronic itching, which may be because there are two techniques of doing the labiaplasty surgery. One method is the trim method, in which we trim the edges of the labia. We give a vertical cut and we trim the edges. The second method is a wedge resection, in which we take off a wedge of the labia. That is our favorite technique, and we at Kyra, we do the wedge technique. The wedge method, it gives a very natural shape to your labia, and the scar is also very negligible. So this is our favorite technique at Kyra Clinic.
So you have seen all the details of the labiaplasty surgery. Yes, as a plastic surgeon, we do many surgeries. If your lips are bigger and if they are disproportionate or they are uneven in size, and sometimes we get the redo cases. As a senior plastic surgeon, they have undergone a surgery before in some other clinic, so I can trim the lips together and make them very aesthetically pleasing. Thank you.
Many females, they have many doubts in mind. What will be the healing process like, or will I have swelling or bruising, or when can I be normal again? So the healing process is not that difficult. Once you are done with the surgery, which is daycare, you can go back to your place. Obviously, if you are getting a surgery done, there will be some swelling and bruising in that area, but that is well taken care of with the painkillers and antibiotics. What we suggest is keep the first 3 days super easy, just relax, binge in Netflix, and you can do icing to reduce the pain and swelling. And after 2 or 3 days, the swelling and pain, it starts reducing. So you can start your normal activities, you can do anything at home, or you can go to your work, but you should avoid some things like gymming or severe exercise, or obviously sexual intercourse. So these are the things which you should which you should avoid. Rest, the healing process is very normal. Just concentrate on hydration and a good diet, and for the first 3 days you need to be relaxed and easy, so you don't have many social obligations or anything. What are the risks and complications after labiaplasty surgery? It's a very simple surgery. What I can say, there are no major risks or infection involved. Like in any other surgery, infection, scarring, bleeding, I have never seen any of these complications. And scarring, if you're afraid that there will be a scar in your labia, there is no scarring.